towards you. And then you go back and bring it down. And see this little tubing, how it's kind of wrapped around this? We actually don't want that. So we don't want that cord ever, that tubing. So you might have to just spin it a little bit because sometimes that will be wrapped all around. And then I pull it forward and push that pin in. So if you ever grab it, which a lot of times you will if the doctor's used it, you're going to have this part on there. And so to take that, because you have to switch it to this or we can't put our piece on there. So to switch that out, there's this little attachment right here that you just need to unscrew this part. And then right here you can kind of see the, you know what that's called, coping or I don't know. So then you just loosen that and unscrew this. To take that part off, and then you add the other one back on. And then bring this tubing up, and I usually kind of set this there so I know right where it goes back in, and then screw that part back into the tubing. Always check your settings. Don't ever just we're good to go. So first thing you do, push start, this green square. Okay, so these are the three things we're looking at. We're looking at the level, the frequency, and the power. So the level that we're gonna always start at, this is for perio. So if we're doing an SRP, we're gonna start at a level of 3, okay? Frequency is always 50. But the doctor may have it at 20, he may have it at 80. And so, but hygiene, it's always 50 for perio, not cold sores. This is perio only, okay? So get the level at 3, get the frequency at 50, and then you're gonna push on. Okay, so here's what we're looking at, is power. The power, we want it as close to 2.0. We don't wanna go above 2.0, but we wanna get close to there. So at 1.0, we want to go higher. So we're going to change the level. Again, never change the frequency, always 50. We're going to change our level to 3.5. Okay, it's still at 1.1. So I'm going to go up to 4. So 1.3. Sometimes I'll go to 4.5. I never go up at 4.5 because at that point, usually by now it's at like 1.7, and when I get to 1.5, I'll actually sometimes go back to 4.0 because sometimes it will actually take the power up, but never go above 4.5. And I never go above 4 if it's not the day of SRP where they've been given injections. If it's just the numbing mouth rinse, I usually stay at 4.
That's too much.
Yeah. So this is actually registering pretty low. Usually today it's registering pretty low. Usually it's about 1.6, 1.7. So the numbers, and so when you put this into your clinical notes, if you change this level, right now I think it's in at 3.0, it's at 50, and it's at 1.7. If you go to 4.5, you don't always, this isn't going to change, so you don't have to adjust that in your notes, and you're going to change this to whatever this is. So always change in your clinical notes to the numbers that we're showing. Okay, and so then we've got our 4, 50, 1.3, and then we're going to hit operator. When this light turns on, it's active. So at this point, everyone should have glasses on. A single person has to have safety glasses on. Even when there's family members sitting over on the couch, anyone that comes in the room when we're lasering has to have glasses on.
I'm getting them.
Gotta check the tip. So I'm just gonna spray a little bit of water just to check that the tip is clear. So then you hit operator. When that light turns on is when this tip is active. Okay, this orange light. When that's on, it means if this gets pressed, the laser's gonna go off. So to check, you just put it over, you depress this, it's clear. And I do this too, when you're going in a lot of deep pockets and you can't see that it doesn't seem like it's working very well, again, you can do that periodically throughout the procedure. Yeah. And that clears the tip pretty good. And you can wipe it with 2x2s as well.
Well, how do you know it's clogged?
Like as you start frosting and you don't see any
It's
change.
not
It won't
frosted.
do anything.
You don't
Okay.
see anything.
I
So when
see.
you're frosting, your tip is perpendicular to the tooth, just right along the gum line, and then when you go sub, you're parallel with the tooth. The tip is not touching the tooth.
Do you go through and frost a few teeth and then go back to the pocket?
So
Or
what
do you-
I do, like on the lower lingual, sometimes you're trying to retract the tongue. So I'll do 31 and 30 and then go sub. And then I'll do 28 and 29.
Make sure
And
you
then I'll
frost
sub.
that
But if
too.
I'm on like the upper left buckle, I'll frost all 4 teeth and then I'll go back and go sub.
Try to get a little.
And then I'll do all the anteriors. But usually I'll do that
Make sure
whole
you're like
area.
fulcruming a little bit,
Frost
you know.
first, like 4 teeth, and then like when I do the anteriors, I'll frost all the lower anteriors on the buckle, and then I'll go sub, and then I'll go on the lingual and do all of them, and then go sub. Just because the frosting goes so fast, and on those that you can't go sub again, you can frost a second time. You can do 2 frosting. If you get to there and you're like, oh, I can't go sub, you can kind of turn it back perpendicular.
Connect the box a little bit.
Okay. Frost around. Like we're doing that again. Okay, so you can go ahead and start. And again, for some reason it's doing the dots again, but you'll see more of a stream. You'll figure
Well,
that
maybe
out.
because it's on such a low setting.
Oh yeah, that might be why.
That makes sense.
Yeah, because I had it at a higher.
Before,
'Cause
yeah.
this is what it does when it does the pull sore.
Okay.
It's like more pulsing,
That
like,
could
or
be
you know.
As you're going, again, don't depress unless you feel that it sinks, okay? Like right there, you can kind of sink. But again, as you're going around, unless it sinks in, don't go sub. Don't like force this under the gums. And on any patient, you don't ever want to force it because as things start reattaching, you don't want to recreate a pocket there that started to heal. So, yeah, and so like right there, if it doesn't really sink easily, don't like create a pocket.
So,
But yeah, that's what you'd be doing if you were, here, keep holding it. Right there, so you can activate right there. And then, again, you can kind of give it and activate it a little bit, yeah.
so
And again, ask the patient to turn their head, if you feel like you can't get that correct angle. Have them close a little bit or open bigger, whichever makes it so you can see better.
okay, then will you turn to your left just a little bit towards Heidi? Awesome. Okay,
So now
just
you need to
parallel
be,
the tooth,
well, you want to
right?
start frosting. You want to frost first at that
Oh, okay,
angle.
gotcha.
And so I found sometimes on these very back ones, it is hard, especially on the size of the patient's mouth. Close down a little bit.
And as far as where I start frosting,
Just start, and if it's easier to start like on 30,
Uh-huh.
you should be able to frost. When you go sub, you're going a little bit slower.
Spend a little bit more time.
Yeah. You
so
can,
if they have recession and you're going sub, you want to make sure they've had LA. Is that right?
not necessarily. So if they have recession and you cannot get that tip down in, only frost that particular area. But if they have a pocket between those, go under the gums first. You're not going to hurt them then. But if you're trying to go sub and they don't have a pocket and they have recession, it's going to hurt because that metal's touching. Even if they've been numbed, they're still going to feel that. And so for some reason, I don't know why, when they've completely been numb, but they have. And so with that recession, again, a lot of times people don't have pockets around the recession, but just kind of feel, don't activate till you're, but if you'll sink, then yeah, go down in and laser. And so when you're not using the laser, hit standby. That'll make it so that if someone stepped on this, it's not going to go off, but it's also going to keep your settings the same. And I'll usually rest it kind of just like right here in the meantime. So to put it back down, you again pull it forward, pull the pin out, and bring it down.
Cross.
way, whoever grabs it next, they're not trying to untwist cords. And
Okay.
And
Gotcha.
same with this cord, like the less kinks and everything, the easier it is for the next person.
Okay. A lot of times I put it through that front handle so they don't fall off, but that.
I mean,
works
this way,
too.
it
Yeah.
just seems like it's easier,
Yeah,
faster,
that
because you know when
makes
you grab a
sense.
sensor and it's like in like a whole bunch of loops and you're like, oh my heck, and you're in a hurry and then you're like trying to
Yeah.
twist it, and it's the same with this cord. I think it just causes less tension on the cord too.
Yeah, of course.
So I would say just make it simple. That way, the next person that grabs it, it's quick and easy.
Perfect.
And again, just making sure that when you guys put it away, this tubing right here
Yeah.
is not twisted around the arm.
Great.
For cold sore, you're gonna go turn that level as far down as it will go. Okay? Frequency. Turn it down as far as it's gonna go. Okay. Frequency, once it goes to 5, a lot of times you can actually go lower on your level. So don't, even though this stops at like 1.5 and then you go lower here, double check. I always just make sure I double check them all that there's not going to go any lower, because on the cold sore and canker you go as low as it will go. And then again, you're just going to hit on. So on your cold sore, you're going to be writing 3 numbers. You're going to be writing your level, your frequency, and your power. When I do a cold sore, I put our laser in there and then I delete. We didn't have a rinse with miracle mouth rinse. Well, we may have if it was a canker sore, but we didn't use ultrasonic. Like, you want to make sure your notes say what you did, because you're not going to be removing biofilm with that ultrasonic when you do a cold sore. And then change your frequency, because the wording in the notes we have with the CO2 and all the information that we need to have legally when we laser is all in our perio laser. It all pertains to the cold sore, other than taking out those things that, like, we didn't frost or we didn't go in a pocket, you know. So just make sure you change those. But this particular information is all accurate.
Okay,
as far as-
so the information on the automatic note that comes up, is there like a laser?
It just says there's in Hygiene, if you hit laser, and so it'll say like treatment perio laser. I'll go in and put treatment canker or cold sore laser at this ulcer laser, and then for the note part, if I just place topical for a cold sore, you're gonna place topical versus miracle mouth rinse. So I'll take out the miracle mouth rinse and put place topical on affected area, and then did this, and then but take out ultrasonic. And then for your post-op instructions, you're going to change. So there's things, I just like to have the information that's for the actual laser.